Everyone, and welcome to this week's COVID-19 vaccination costing for scale-up learning session. My name is Bruce Struminger, and I'm with Project ECHO at the University of New Mexico, and we're very pleased to be supporting this WHO vaccine learning series. I'm going to be running through a few housekeeping items before we launch into the main program. Next slide. First, we have interpretation available in French. So for our Francophone colleagues, please take advantage of that opportunity by going to the small globe at the bottom right of your Zoom toolbar that says interpretation underneath it. And you'll have an opportunity to select mute original audio if you just want to hear the interpretation. Next slide. We really look forward to your questions and comments about today's topic. Please put them in the Q&A feature just to the left of the interpretation, also at the bottom right of the Zoom toolbar. We'll be monitoring that and try to get to as many of those questions as possible during the session, but we'll also be answering them, any we can't get to during the session afterwards, and sharing all the questions with answers later. If you've got any IT or logistic questions or questions about the certificate of attendance, please put those in the chat feature also along the bottom of the Zoom toolbar, and we'll try to help you out as best we can. Next slide. For those who might be interested, there is an option for closed captioning in English, and you can click on the live transcript icon and choose show subtitle, and you should see captioning appear on the screen. And then you can click hide subtitle if you want that to disappear. Next slide. We are recording today's session, as we're recording all the sessions for this series, and your attendance is consent to be recorded. The recordings will be shared both in English and French. We'll share a link to the websites. There's a TechNet 21 website that will have all the archive of the recordings, and we're also hosting a website for this series that will have those recordings available. We really look forward to your feedback on how this series, in today's session in particular, went. About 15 minutes before the end of the session, we'll share a link to a brief 2 to 3 minute survey. After you complete that survey, you will receive a certificate of attendance that will be electronic. That's through the University of New Mexico, where Project ECHO is based. And you'll have at least 48 hours to complete that survey and receive that certificate. Next slide. Just a note about data use. All of your individual data will be de-identified and kept confidential. We take data stewardship very seriously, and what data is shared with WHO is all de-identified and aggregated. Next slide. With that, it's my pleasure to hand over the microphone to Karine Jung at WHO to formally welcome us and launch today's session. Karine.
Thank you, Bruce. So good morning, afternoon, and good evening, everyone. Thanks for being here today. I'm Karine Yang from the WHO Immunization Department. Before we go into the session, let's warm up with the poll. Can the ECHO team please help open up the poll to interact with the attendees? So there will be 3 questions that we would like to understand from you all, and you will later see the pop-up box with the 3 questions. And for the first questions, we would like to ask if you used the COVID-19 vaccine introduction and deployment costing tool, the CVIC tool, and yes or no. And the second questions, are you deploying or supporting development of the national deployment and vaccination plan budgeting or financing strategy? And the answer is yes, probably not, that's not confirmed. yes, and sorry, no, and unlikely to. And the last questions, are you facing challenges in COVID-19 vaccine costing, budgeting, and financing? Yes or no? I think you all can see the poll questions. So you can try to answer these questions, and later we can also know how the distribution is, and we can also share the result here. When we have about like half of the you answer the questions, we will then announce the results. I can see the percentage. So if the Echo team can see the how many people replied, as long as you're ready, we can show the results of the poll.
52% have replied till now.
Okay. Okay, good. So we are seeing the result. So 80% of you have not used the CVIC tool. And okay, that's good. We are now introducing so you can have a view of what this is. And around, okay, 40% developing or supporting the budgeting and financing, and half probably or not confirmed, and 80% see what we can support. Okay, so maybe we can just start today's sessions. Next slide, please. And we will start with some announcements from the department. There are some new guidance documents available in the past week. After this session, you can download this slide deck, and you can also have the access of these links. And the first guidance is the guidance on utilization of COVID-19 vaccines before expiry, and also the WHO SAGE roadmap of prioritizing use of COVID-19 vaccines in the context of limited supply. Next slide, please. And the guidance for clinical case management of TTS following vaccination to prevent COVID-19. And the last announcement is the experience sharing and lessons learned session of mini CPI, the COVID-19 vaccination interaction review next Wednesday. And here you can see the registration link. Next, please. Okay, so today is the second session of this ECHO series. Last Tuesday, we had a session on the CDS funding, and today we will focus on the COVID-19 vaccination costing for scale up. We will have the repeated session next week at a later time to fit people in different time zones. Next slide. Then in August to December, we will have other sessions with different topics on costing, budgeting, and financing of COVID-19 vaccination. Next slide. Okay, this slide shows you what you expect from today. We will first have Dr. Raymond Hudubesi, the team lead of Value of Vaccines Economics and Modeling from WHO, to talk on the importance and challenges of COVID-19 vaccine costing. Then I will talk on how to get the materials and support for COVID-19 vaccine costing and the costing tool. After that, Dr. Yap Wei-An, the developer of the CVIC tool, will introduce the easy version of the tool and guide us on how to obtain a rapid initial cost estimate. And finally, we will have around 30 minutes for technical assistance session. You can put your questions in the Q&A functions at the bottom of the Zoom, and we can discuss together. And after each presentation, We will have around 4 minutes for Q&A to clarify context of the presentation. And all the technical questions can be discussed together during the technical assistance session at the end. Okay, next please. Okay, for the goal of the session, we will introduce the easy version of CVIC and support countries on COVID-19 costing, COVID-19 vaccine costing for scale up. And we anticipate that after this session, you will be able to understand the importance of careful costing of COVID-19 vaccination, generate rapid initial cost estimates using the CVIC 2.2 Easy, clarify questions regarding the tool, and learn how to seek technical support on COVID-19 costing. Next, please. Okay, without further ado, let's start the first presentation by Dr. Raymond Hudubasi. Raymond, please.
Thank you, Corinne, for this introduction. Hello, everyone. I would like to give you a couple of introductory slides on why COVID-19 vaccine costing is important and what the challenges are in countries. I will start now with some introductory slides with regards to the status we are with regards to the COVID-19 vaccine globally. Next slide. So as of 19 of July, beginning of this week, over 3.6 billion doses of COVID-19 vaccines have been administered in 217 countries, areas, territories, and economies. And on this slide, you can see the total doses administered per 100 population. What is apparent from this slide, in the darker greens are high-income countries where there's a higher level of total doses administered per 100 population compared to low and middle-income countries. Next slide, please. This inequity, however, is decreasing. On this slide, you see since the start from the introduction of a COVID-19 vaccine that the ratio of high-income countries versus low-income countries in terms of doses per inhabitant being administered is coming more equal, but still 62 more times doses are administered higher in high-income countries than in low-income countries. Next slide, please. So here you see more details by World Bank regions that the vaccination progress is in particular being accelerated by large countries like China and India. And in these bars, again, you see the cumulative COVID-19 doses administered. On the left-hand side, you see that over 40% of the global doses administered is in China, while they're making less than 1/5 of the world population. Again, on the right-hand side, you see the dose administered per 100 population, and you see that 94 out of 100 are vaccinated in China compared to 1.4 in low-income countries. So we still have a long way to go, and we need to scale this up as soon as possible to address these inequities. Next, please. Next slide, please. So the COVID supply surge in the fourth quarter of this year, we estimate that AMC countries are estimated to receive almost 2 billion doses. The majority of supply comes from COVAX, about 50%, and 30%, almost 30% by bilateral deals. There is also a possible additional supply from the African Union, the AU, which is currently under negotiation. In order to absorb such volumes, countries really need to take action now. They need to start planning, put operational funding in place, but also to scale up the healthcare workforce. So I will go in my next 3 slides in more detail into that. Next slide, please. So given this expected supply surge over the coming months and year, urgent action is needed to support countries, in particular also with national planning and costing. So countries need to update their national plans to account for this increased supply. And this includes the need to ramp up cold chain equipment, prepare demand, planning, but also submit costing needs, etc. For that, WHO has developed the NDVP that helps countries to develop a national plan. Countries can also submit their budget needs to the partners platform, and donors can also share information on available resources. Next slide. Another issue is the funding. As of 30th of June, over $2.3 billion has been pledged. Countries are in need of funding in preparation for the ramp up. And on the right-hand side of this slide, you see where the funding is coming from, primarily from multilateral development banks, bilateral donors and foundations, and other international organizations like Gavi, UNICEF, and the Global Fund. Next slide, please. The supply of this unprecedented COVID-19 vaccine volumes to countries will mean the need to significantly ramp up human resources. And countries will need to strategize around this and work with emergency and humanitarian actors. On the right-hand side of this slide, you see an estimate of the global cost by UNICEF for total delivery of the vaccine and human resource needs. You see that over 3 billion is needed, of which 1/3, 1 billion is needed for human resource capacity to increase, in particular in low and middle income countries. Next slide. So when it comes to costing and financing the national plan for COVID-19 vaccines, there are 5 interrelated steps to go through. As I said earlier, the development of a comprehensive and feasible NDVP, a national deployment and vaccination plan, that is crucial and that needs to be agreed across all partners involved in rolling out the vaccine. The second step is based on this NDVP to come up with credible costing, not only for vaccine procurement, so the vaccine itself, but also the operational activities, the delivery activities to get the vaccine from port of entry to the target groups. It has to be in alignment with this NDVP, and so that it is the basis of a meaningful conversation with the government and financing partners. The third step, once you know the costing, you need to identify where all these the finances will come from. You have to identify existing domestic resources and also go for mobilization of additional resources to finance your plan, both from domestic or from external funding. Based on this costing plan and also on an identification of resource mapping, engaging stakeholders within and outside health and across national, international, and private and public sectors is important. The fourth step is to look at the money available. So you need to process of preparing a budget formulation, the execution of that budget, and also tracking the budget. And the fifth step is then to build this into your health systems financing mechanism and bottlenecks to other health interventions. So it becomes an holistic part of your overall healthcare financing system. Next slide. So a couple of months, we did a survey among countries on the need for a COVID-19 vaccine delivery costing. And we asked why countries are doing these estimations of delivery costs of COVID-19. So the poll learned us that most countries do this costing estimates or need this cost estimate for the submission of their NDVP, but also for partner finance mobilization and domestic resource mobilization. And they find it also important as part of their vaccination strategic plan. Next slide, please. So why is it important to cost out the COVID-19 vaccine? First, to ensure that health and economic benefits of vaccinations are realized without harming the existing essential services in place. You should not divert too many resources from existing services. You also need to identify and value resources needs and available to inform domestic resource mobilization, but also requests for external funding. The third reason why it is important to cost out your COVID-19 delivery component is to optimize and look at the optimal delivery strategies and coverage scenarios of your plan. Will you deliver the vaccine through fixed sites, outreach, or other modes? And also in terms of the coverage rates, what is feasible in your country and what are the cost implications? Not only in terms of coverage, but also which target populations to prioritize. This all to minimize the financial needs and the health system's burden. The fourth reason why it is important to cost out the delivery of COVID-19 vaccine is to identify specific bottlenecks and financial gaps, and specifically for human resource capacity. And finally, as I said earlier, facilitating a scale-up of vaccine of COVID-19 vaccination, which is protective of the essential health services, so that it does not divert many resources from existing services. Next slide, please. So let me end with, again, some results from the survey we did a couple of months ago. What countries face in terms of challenges with regard to costing out COVID-19 vaccine delivery. And here you see the results where countries agree or disagree with the challenges we asked in the survey. Countries overall find it difficult to determine the operational assumptions of a plan to roll out the vaccines. Also, to obtain country-level data is not that obvious for rolling out a program which you have not experience with. Also, a plan that is in line with your NDVP or your guidance, national plan, is not easy to find, but also to obtain technical assistance. And finally, also a tool that is well-structured and user-friendly is not obvious to find or to develop. So we hope with this session and the introduction of the CVIC tool, Karine will introduce now and Wei Yan will go into more detail, we will address many of the challenges countries face with regards to COVID-19 costing. So let me hand back to Karine, and I'm happy to answer questions if there are any. Over.
Thank you, Raymond. So any questions from the floor? So you can put in the Q&A. Okay. Yeah, I see one question, but not fully related to the session. So maybe we can get back later with the colleague in India. Okay. Any questions? So if no burning questions for Raymond, then we can just move ahead with the next presentations. And at the end, we can also come back to have the technical assistance sessions to answer more questions. So is it someone? Okay, I see one question in the chat. How does CVIC 2 can be integrated or aligned with immunization costing and planning in general? Okay, so I think we can leave these questions later. I think we will cover a bit, and maybe after the presentation, then we can explain more on that. Thank you for the questions. Okay. Okay, so let me start my presentations, and next slide, please. Okay, before going into my presentation, I would like to play a video recapping some points raised by Raymond and on the importance of the COVID-19 vaccine costing, and also on how the CVIC tool can help on this. Yeah, we can play the video, please.
COVID-19 pandemic has radically changed our world, affecting millions of people. After more than a year of uncertainty and anxiety, the life-saving vaccines we have been waiting for are finally here. A lot of hard work still lies ahead, but the hope these vaccines bring is a glimmer of light for everyone. In the race to get as many people vaccinated as soon as possible, countries need to develop rollout plans. Adequate resources for implementing a plan can only be raised when we know how much it will cost. The estimation of costs needs to be done credibly, taking into consideration the various strategies being proposed to ensure that vaccines reach the target populations. The estimation of costs should be undertaken alongside the development of the plan, as countries should not plan for something that is unaffordable. When proposing strategies, a close eye needs to be kept on the available budget. Planning and costing a vaccine rollout on this scale can be a big challenge, but one which could take considerable time and resources to put together. In a way, it's a lot like building a puzzle. There are plenty of moving pieces, and trying to see the big picture while the clock is ticking is not easy. To help you effectively cost your country's rollout plan, the World Health Organization and UNICEF have developed the COVID-19 Vaccine Introduction and Deployment Costing Tool, or CVIC. The CVIC tool is an Excel-based costing platform with a large amount of country-level data preloaded. The primary purpose of the CVIC tool is to produce cost estimates rapidly by using data averages. The preloaded data is concerned with demographic, epidemiological, geographic, and logistic information, as well as health financing and human resources. While the preloaded data makes it less time-consuming for users to generate results, all data should be checked and, where possible, replaced with more reliable data specific to your country. Adding the relevant country-specific data using a team-based approach is particularly useful, as various stakeholders can participate in solving the puzzle together. This also ensures that the solution has wider buy-in. Harnessing the support and problem-solving skills of your team will ensure a much smoother and more accurate process. And remember, support on using the CVIC tool is available when you need it. The CVIC tool is specifically customized for COVID-19 vaccinations and recognizes that a bird's-eye view of multiple delivery strategies needs to be considered before and after vaccine rollout. It also takes into account the uncertainty of some parameters, for example, the time it takes to vaccinate a person. The tool allows you to factor in costs for human resources, vaccine transport, cold chain, last mile service delivery, and more. During the design phase of the CVIC tool, relevant key stakeholders were consulted, and the needs of countries and partners were taken into account. These findings led to the development of a partner resource mapping function, making it easier for countries and partners to work together. A solid, credible, costed plan is vital for an effective vaccine rollout and partner financing. Using the CVIC tool allows us to see the bigger picture, taking us one step closer to a COVID-free world.
Okay, thanks. So we can now get back to the slides. So I think after the video, you may have a brief idea on how the CVIC tool works. And I will further explain more, and then Mayan will go more deeply on that. And next slide. Thanks. Okay, so the CVIC tool is developed to provide a structured and comprehensive estimation of incremental, operational, and selected capital costs to introduce COVID-19 vaccines for resources mobilization, budgeting, request for external funding, and strategy refinement. And it can support credible COVID-19 vaccination costing to facilitate a dialogue with stakeholders while maintaining sensitivity to protect essential health services. Next slide, please. There are 5 C's for the CVIC tool. The first and second, convenient and customized. Some data has been pre-populated in the tool and user can adjust it as they wish. And second, changeable. The tool includes an updatable vaccine specification database. And third, comprehensive. You can use the tool to cast for different scenarios for optimization. And since the situation is always changing, when you are deploying the vaccines, you would like to do this. When time goes, you may need to cost for the scaling of the vaccination. You may also need to do that. So you may need to change a bit. Then you may change the specific parameters in the tool and try to get different estimation rather than think about the budget again from the start. And the fourth, compatible. The CVIC tool is compatible with the partners platform, and countries can upload complete CVIC tool to request resource needs. And also the CVIC tool is in line with the NDVP cost category and also the SAGE target population. Next slide, please. Okay. As far as we know, over 35 countries have tried to use or going to use the CVIC tool. Most of them are from Afro countries, and now we recently have more European countries using the CVIC tool. Here is a list for your reference. Next. Okay, we have the COVID-19 vaccine introduction toolkit, equipping all countries to prepare for the implementation of COVID-19 vaccination by providing guidance, tools, and training. In the costing and funding section, you can find all the supporting materials on costing, budgeting, and financing. And you can also download the CVIC tool there. Next slide. And we have just launched a course in OpenWHO this week on the training of the use of CVIC. There are 8 lessons guiding you how to use the tool, and you can take your own pace to complete the course. And later you can go to the link. You can also see in the chat the link to the OpenWHO course. You can learn by yourself on the how to use CVIC. And also we will have a step-by-step written user manual which goes through each of the single input cells to allow users to have a complete understanding of the tool and its assumptions. And recordings of previous trainings is also available online. Next slide. So we are providing all kinds of materials to support COVID-19 vaccine costing, as listed in the previous slides. But of course, you may also need to speak to someone to have one-to-one technical assistance. We are always welcome to reach out. You are always welcome to reach out us through either the generic email put here or through the focal points from the 6 regions. I think this is my last slide. I'm happy to take any questions regarding CVIC or support. Thank you. I hand over to Raymond.
Yes, thank you, Corinne. As far I can see, there are not any specific questions, except one question that asks about whether countries with low resource mobilization should advocate for countries to mobilize these resources for their vaccination plans, or maybe reach out to the IMF or World Bank to fill the additional needs countries have for their rollout of vaccination. And I think I can also answer that question myself. As I said during my presentation, funding is also committed from for example, the World Bank, and there are grants and loans that will be available for countries. So I definitely would encourage countries also to reach out to their local colleagues from these international organizations in order to reach out for additional funding in addition to the domestic funding, even if low, but to fill the gaps. I don't see any other question, Karim. So I propose we move on to Wei-An's.
Yeah, so
Question?
let's, yeah. So please, well, I'm happy to hand over to Wei-An to talk about how to obtain a rapid and initial cost estimate using the CVIC 2.2 Easy. Wei-An, please.
And I believe that obtaining a rapid initial cost estimate is an important part of advocating for resources, especially for countries with low resource availability, and giving the partner community a very clear plan which is costed credibly, to me, is a very key part of that. And this is what I would like to talk about today. So good afternoon, good morning, good night, everybody. My name is Wei-An, and I'd like to give you a short introduction to the CVIC 2.2 Easy tool, which is designed to help countries, especially AMC 92 countries, get very rapid cost estimates. The original CVIC tool was designed to be a very comprehensive costing tool. So it was not designed to get numbers in the fastest possible manner, but it was designed to provoke a very deep conversation at the country level between country stakeholders on the feasibility and the practicability of their NDVP plans. Exactly which target population do they mean? When do they want to vaccinate them? How do they actually plan to reach the people that they want to vaccinate? And what vaccines do they plan to use? What delivery strategies will be used? How can delivery be even optimized? And how will the rollout of vaccinations be sequenced? These are all the conversations that the CVIC tool was designed to provoke as part of its comprehensiveness. But we also recognize there's a need for countries to come up with a number in the fastest possible manner. And so that's where this CVIC 2.2 Easy tool comes in. What it does is it lowers the barriers of entry for use so that only about 10 cell inputs are needed in order to get initial cost estimates. A good thing about it is that the CVIC 2.2 Easy tool uses the same cost estimation engine and model as CVIC 2.2, and in fact, it's actually nearly identical, except that there are many, many more cell inputs which are already pre-filled in advance, including for country-specific unit costs, so that it makes it easier for countries to easily get an estimate. And when I talk about countries, I'm talking particularly about AMC 92 countries. Although many inputs are pre-filled, users may also change this, and in fact are encouraged to do so. May I have the next slide, please? May I have the next slide, please? Perfect. So this shows a comparison with the CVIC 2.2 tool and the CVIC 2.2 Easy tool. Now you'll notice that both tools require basic information like the name of the country and the currency filled in. For users of CVIC, and I know only 20% of the people here have tried to use CVIC from the poll that we did earlier, but for these 20%, you'll know that when you select the country, that it will just extract all this information from public databases for you so that you have information on the country's demographics just inputted automatically for you. So that's actually the same for the CVIC 2.2 Easy tool. But where it differs is in the following, is in the next few rows. CVIC 2.2 requires users to think about delivery assumptions. So there are a lot of cells which need an input. But CVIC 2.2 Easy makes broad assumptions on many but not all of these delivery parameters. Likewise, for the target population and vaccine supply, CVIC 2.2 does not make many assumptions, so it requires a lot more inputs. But CVIC 2.2 Easy makes broad assumptions, so initial inputs are not required, but they can be modified as the country's needs, as the country requires. Note that CVIC 2.2 Easy is tuned for COVAX AMC 92 countries. The assumptions that we are using, especially for vaccine supply, are less relevant for non-AMC countries. Importantly, unit costs are also pre-filled into the CVIC 2.2 Easy tool. And just to let you know what's the source of that, it is actually from the global costing estimates, which were done by Ulla Griffiths and team. And so essentially, it tries to mimic the global estimates at the country level. Next slide, please. So this is what the standardized population looked like. Maybe standardized is not the right word. It's more like the population, the default population that it starts off with, 1% health workers, etc. But countries, you can just change this, but that's what it just starts off with, but you're not obliged to follow it. That's just what it starts off with. Delivery parameters, we are using the AstraZeneca vaccine because that's the most common vaccine used by COVAX countries, but feel free to change these. Vaccine wastage rates, we're assuming 10%, expected uptake is about 80 to 95%, depending on the delivery modality. And as I mentioned, the unit costs are tuned to the global estimate. So for example, we're using $1.39 for per diem outreach, $1.49 for transport outreach. But again, just to remind you again and again, this is just a starting point and you can change those numbers. On the right is the bare minimum settings that you will need to change. And I think it's quite easy. You just need to specify what country you're costing it for, what currency that the country wishes to use, in addition to US dollars. US dollars are always an option for this buy currency tool. The next set of questions is just 5 further questions, which help to define some of the distribution and service points. How many provinces does your country have? How many districts does it have? How many fixed sites will you be using for delivering the vaccines? How many campaign sites? How many outreach sites? And then finally, you may need to do some demand and supply matching, which you can, and the way to do that, you can just adjust the population parameters, like whether you want 1% health workers or 2%, for example. Prioritization, you can just decide when you want to vaccinate these health workers. Do you want to vaccinate them this year or next year? Or supply parameters. So for example, if your country got a bilateral donation from another partner, you can just put that in. So those are the kind of things that you need at the bare minimum settings. May I have the next slide, please, which is actually the final slide before we go to Excel. The cost estimates, as I mentioned again, are tuned so that it will give you a cost estimate very similar to the global costing estimate. It won't be identical as the costing model is actually different, but I want to stress that this is just a starting point for these estimates. It is not your final costing estimate, but it allows you to just have specific numbers to begin a conversation with country stakeholders. And at this point, I would like to show you an Excel file of just how quickly we can do this. So that's perfect. So I'm going to share my screen. Just give me a few seconds. Okay. May I just confirm that it is possible to see my screen?
Yes.
Great. So I just want to stress that I'm not going to go through the whole tool. Why? It's because we already have an open WHO course with a video run through of how to fill this in for CVIC 2.2 and just encourage you to use that. But what I'm going to do today is just to tell you about the 5 to 10 input cells that you need to fill in order to get an initial estimate. And the first cell is just to say that you've accepted the disclaimer so that you understand the limitations and strengths of this tool. And all you have to do is just click here and just say, I accept it, and it turns green. Okay, that's quite easy, I believe. Then you go to the next tab. How do you do so? You just scroll down and you just go to the next item. You need to specify the name of the country. And I just want to highlight that the difference between the CVIC 2.2 Easy and CVIC 2.2 is that the key 5 to 10 cells which need to be filled up are in dark orange. So just look for those. And to fill in the country, just use the drop-down menu and select the country. And in this case, I'll just use Algeria as an example. Algeria uses the dinars, and it's abbreviated as DZD. So I'm just putting that in, and I've put in the country and the currency. I can now move on to some delivery parameters. I'm just going to scroll down to row 190. The rest have all been pre-filled and are just based on a standard population and just very common delivery parameters, which you may edit, and you're in fact very much encouraged to edit it, and the explanation for that is provided in the Open WHO course, so I will not repeat it. So in the example of Algeria, let me just orientate you. We're at a point in the tool where we're discussing delivery parameters, section A 2.3, and in this case we're talking about the distribution and service points. And the first question is like, how many provinces or states does your country have? And in this case, let me just use 20 as an example. I'm not claiming that that's the case for Algeria, but I'm just using it as an example. And then next, just fill in how many districts the country has. And in this case, I'll use 200 as an example. and then fill in the number of fixed sites from which you want to deliver the vaccine from. And note that these are fixed sites which already have cold storage. So it'll be like a hospital, or it'll be like a large clinic, for example. And in this case, let's just use 1,000. And then we move on to campaign sites, which are sites which could range from a village hall where you tell everybody to meet there this Sunday and get themselves vaccinated, or it can even be a stadium in the middle of a big city and cater for a huge number of people. In this example, we'll just use 100. And outreach sites are sites that the team would need to go for an overnight visit lasting a couple of days. So these are very remote areas where they would have to take, let's say, a 4-wheel drive there, spend the night and vaccinate the surrounding population. So in this case, we're just going to use an example of 100. And I think you might notice also that the boxes change from pink to a green okay, and just tells you that everything's fine. And to be honest, that's it. The rest are already pre-filled. You know, I mentioned the choice of using AstraZeneca, but if you want to change it, it's just a drop-down menu to pick a different vaccine if you want, etc. It's quite convenient. If you want different vaccine wastage rate of 5%, you can change it as such, but let's just stick to 10% for this example. And unit costs are already inputted as per the global estimates, so we can actually just jump straight to results. Oops, sorry, I have a mouse problem. I'm just clicking the button on top here, and it tells us the cost estimates for Algeria, and we're all done. And it'll tell you not just the total, it'll tell you the total over time, and it'll tell you a breakdown of the cost estimates, and it'll tell you about your human resource needs during this period in time, and that's quite clear, and its impact on the health systems. All these I'm not going to go through in detail now because it's covered in the Open WHO course. So that's it for the Excel demo. I just want to show you how easy it is with CVIC 2.2 Easy. Just fill in country, currency, provinces, states, fixed sites, campaign sites, and outreach sites, and you're done. And that's it for my presentation.
Thank you, Wayne. So it's good to know that we now have an easy version, so that we can start with rapid estimates. And so I think we will just combine the Q&A session for Wayne with the technical assistance session. So now open questions from the floor, and let me check the Q&A section. Okay, so we have several questions here. Okay, let me see. Okay, so we have the questions on do any of the tools take into consideration the protection grade expected per vaccine type and the potential impact for the need of boosters?
I can take that question.
Please.
Yeah, so yes, to some extent it does. And the way the CVIC tool does so is that it allows you to revaccinate the exact same population again in subsequent years. So if I give an example, if you want to revaccinate your health workers, let's say you've already vaccinated 100% of them in 2021, but then you think that perhaps the vaccine durability is not going to be particularly great and you may need to revaccinate them again in 2022, you can revaccinate, you can specify in your prioritization plan that you plan to revaccinate that same population in subsequent years. So it does to that extent, but it's not a tool which is going to input the 97%, 63%, 60%, and then put in all the variants of concern and the epidemiology of the tool, and it will tell you whether you've achieved herd immunity and when you're going to lose it. I think that's a very useful tool to have, but that's not the purpose of this costing tool. So I think I hope that helps, and feel free to just come back on this question. So it does not tell you about the epidemiological or herd immunity impact of the vaccination strategy. It's just a costing tool.
Okay, thank you, Wayne. And the next question is, where is demand creation activities provided for? And what priority activities that must be involved in the conversations? Any standards?
I think I can take that question too. So we have a whole mini module, if you like, on demand creation, demand generation, I think is the phrase typically used under unit costs as well, which will allow you to specify activities which happen at the local, i.e. at the health facility level or the service point level, if you like. And in addition, we have the tool you can calculate at the central level in alignment with the NDVP and the VREF, VREF, whatever activities which are pertaining to demand generation, which have been mentioned in those normative documents. So certainly demand generation is a very important aspect of costing, and it's well covered in this tool. I think, Karen, you also may have you may have missed the question by Liban. How does COVID-19 delivery vaccines in rural areas, how is that done where the country is not at all open? Again, this is a core feature, I would say, of the CVIC 2.2 tool. And with a single number, all you need to tell the tool really is what % of the population lives in an area which requires outreach. That's it. And just that single number, and that's all you need, and the tool will take care of the rest. So it will apply that assumption for certain target populations like older persons or non-older persons, and decide on how best to reach those people. So it's really a core feature of the tool, and it really separates the cost estimates of those people because of the added need for logistical costs like transportation, and probably even added health worker time, significantly added health worker time. So those are all taken into consideration in tool in this very easy way.
Does Raymond have any supplement on this?
No, just to add on the last question, how easily to reach to underserved populations in rural or subnational and in countries. I think the issue with regard to demand generation is also related to that, and the tool allows you to identify the additional activities you might need in order to get a realistic costing on that. Over.
Okay, thank you. Okay, so let's go to the next. How the CVIC tool can be used for countries which already deployed COVID-19 vaccines in early 2021. First part, and second part, how far the costing need to be recalculated or readjusted for the following budget cycle purpose. And third, can CVIC tool specifically used for subnational planning and budgeting? Okay, so I think Wei-An may have questions on two.
Yeah, I can take these questions too. Yeah. So basically, the CVIC tool will estimate the total resource need, and if some of these costs have already been incurred or do not need to be incurred anymore, then you can just disregard it, because the tool will just produce the estimates based on a time period basis. So every 6 monthly time period. So you could say that now it's already, let's say it's January 2022, then we can just disregard the costs. Even though it's generated, you can just disregard it for 2021, the first half, and the second half of 2021. It's up to you. There's another way to do this, which is there's a resource mapping tool. So you could, in theory, just allocate certain expended items to another category of your own choosing, which is like spent or something along those lines. So that's another option for people who are already doing so. And I just want to re-emphasize that this tool is not intended just for countries who are just about to start out their COVID-19 deployment plans. The topic of this session overall is about costing for scale up. And so I think some of the initial costs, which maybe have already been incurred in terms of regulatory costs, that those are, you can put that aside. But the important thing is, especially for countries which are like sort of the 1% level of immunizations and are going to ramp up to, let's say, 20% in 6 months, I think the cost estimates are very significant, and it's really important to optimize your costs and to get the scenarios right. And this is one thing that the CVIC tool was really designed for, so you can really optimize your costs and think carefully about your delivery modalities so that you can minimize the resource needs required for that. Second question was on subnational planning and budgeting. So there was actually quite a lot of demand for a subnational tool. At least it was expressed to us, to the extent that we created a special version of the CVIC tool, which you can ask for, which allows for subnational planning. Basically, what it does is it sort of no longer confines you to a selection of the member states within the WHO region, but allows you to customize a territory with its own population and with its own area and parameters. So feel free to reach out to the team if you have any subnational budgetary needs. Happy to, there's already a version of it which was intended for that purpose.
Okay, thank you, Ryan. Okay, so we can, I see the questions in French, and sorry, I don't know French, but I Google Translate. If I know I interpret wrongly, just let me know. So, the message is the country Mali is not in the list of countries having chosen or wanting to choose the CVIC tool, which other exists for them to properly estimate. So the list that I showed is the country that we know using CVIC or asking support to use CVIC, so that we know they are using or going to use. So if you knowing your country is using or would like to use, and happy to support. So, and I don't quite understand the second part. I'm not sure whether it's a Google Translate problem or not. So if you can clarify the second part, or Raymond, you know, okay.
Yeah, so the second part is, are there any other tools other than CVIC out there?
Okay.
You want to take this, Green, or do you want me?
Yeah, so I think there is a number of tools around, but so you may also heard from others, like World Bank may have some template, or UNICEF may also have their own one, also for Gavi, but a different tool may have different purpose. So for the CVIC tool now, we are saying is like a comprehensive one, so you can estimate the incremental cost for the COVID-19 vaccination, and which is really a step-by-step or doing all the different target populations, modalities, focusing on different. But for other tool, that as far as we know, the other template is not that comprehensive. But if you are familiar with other template or tool, there is no rush to move to other tool. You can use your own tool. It doesn't matter. But if you would like to have a comprehensive costing, we will introduce CVIC, and we would like to support you, because this is good for country to have a better planning, and also have a good starting costing for better budgeting and financing later on.
And I can confirm that Mali is on the list of countries for which there's preloaded data on CVIC, so it will work fine.
Thanks. Okay, so let's go to the next questions. Okay, so the tool is pretty flexible and some items are previewed. However, is this possible to include country-specific interventions? Does it include the 6 pillars of the health system cost? So the country-specific interventions.
Sorry.
Yeah.
Yes. I can attempt to start, and then maybe others can add on. So the tool is extremely flexible for adding additional interventions. So for example, for each of the categories, like somebody was asking about demand generation, you can actually customize the kind of inputs required for that, both at the local level and also at the central level. And you can do so for all the sub items of that. I'll also add that you can add an intervention called I can't remember the exact phrasing, opportunistic delivery of co-delivery of other essential health services along those lines. So that's, for example, in a situation where you may want to check blood pressure for the older population at the same time as vaccinating them. You can even cost for an intervention like that. On the 6 pillars of health system cost, I'm not quite sure what's being referred to. Is it the building blocks like HR, etc.? Well, to some extent, yes, we have all these categories, but it may not be exactly named the same way as the health system's building blocks, but it's more aligned to immunizations. At least that's my understanding of the question, but others feel free to add.
Yeah, so let me come in here. So the 6 pillars is part of the country readiness plans, and this goes beyond vaccination. So I have to emphasize that the CVIC tool It's really focusing on pillar 10. It's really on rolling out COVID-19 vaccines in countries. It does not take into other interventions like those diagnostics in the future or other related COVID-19 vaccine interventions. So it's really, the scope is really on COVID-19 vaccines. But again, as I said in my answer, in one of my answers to the questions on how this can be integrated in existing tools, we have been developing this tool in alignment with existing tools so that the definitions, the classifications are quite standardized so that it can communicate with other existing tools or tools to be developed, where we try to get international agreement on the methods, definitions, and the classifications. Over.
Thank you. And we are having another question. So one of the challenges we face in costing and budgeting COVID-19 vaccines delivery is the uncertainty around the global supply in terms of timeline and incoming quantity, and an unpredictable and evolving nature of disease outbreaks, which change short-term priorities and therefore delivery strategies in rollout. How can we use CVIC tool under this dynamic context?
Should I answer that?
Yeah.
So I think CVIC is particularly helpful in a situation like this, because if you need to change just one parameter, you do not need to go through your whole spreadsheet. And if you're using an EPI kind of based tool, you'd have to change everything again. Like if you want to switch from a 2-dose to a 1-dose vaccine, and then you have to change everything again if you're using a spreadsheet tool. But with CVIC, if you want to change from an AstraZeneca 2-dose to a 1-dose Johnson & Johnson, you just use the drop-down box and say, I want Johnson & Johnson instead. So the good way for that, I'll just make 2 points. One is you can just create multiple scenarios and just say, like, what if we get a Johnson & Johnson? What if we get another one? And all the difference is you just need to change 1 or 2 cells, which is the difference. And that will tell you, well, that's going to be the implications if you go for this scenario. And the other implications if you go for the other scenario. The other thing I will also add is that the tool separates between delivery costs and the cost of vaccinations itself. So if you know that, let's say your strategy is very likely to use a 2-dose vaccine, but you don't know exactly which it is or when you're going to get, at least you can cost out the delivery cost aspect. And then when you know the supply, the cost of the vaccine procurement itself, then you can put that in separately, or you can at least have this information held separately so you know where the uncertainties arise. So I think costing in a dynamic context is really one of the strengths of the tool. Let me also add one more point. It's like, what if suddenly overnight we have a new vaccine from, I don't know, another country, and it's like really 100% efficacy? How does CVIC deal with it? Well, we can actually push an update on an updatable vaccine database. So let's say WHO issues an EUL for another vaccine tomorrow, we can actually add it to the CVIC tool, even though you have already pre-filled it and you've already costed it. You just need to, and if you go to Open WHO cost, you know that you can actually refresh the data set for the CVIC tool even after having filled it in, and you bring in whatever new vaccine types there are, and then you go to the drop-down menu and say, I want to use this new type, and let me see what the implications are. So the CVIC tool is really designed for a dynamic situation like that, and really happy to discuss that further.
If I may add, Queen. So I fully agree with what Wei-Jan said, on the uncertainties, but also the tool is that comprehensive that it really disentangles, all the ingredients behind these calculations. And that can be used for scenario analysis, as Wei-Jan has explained, but it also allows for conversations with all partners involved, and being explicit and transparent on the assumptions or what goes behind these numbers is also important at country level, so that all partners involved in the rollout, but also estimating the costs, kind of have ownership over the numbers and understand how these numbers are built up, what are the assumptions with regard to the number of doses, coverage, but also delivery strategies, etc. Over.
Thank you both. Okay, so the next questions in a Q&A is about the vaccine price, I think the costing of vaccines deliveries should also take into account conflict affecting areas. In Cameroon, the social political crisis in Anglophone regions has skyrocketed cost of services. Hope these situations have been taken into consideration.
I'll take that question if you don't
Yeah.
mind. So
Okay.
once again, the CVIC tool was built for fragile and conflict affected situations, FCAS. And if your country is already on the list, according to I think the World Bank database of a FCAS country, it will automatically give you the option to add on security costs for your vaccination delivery plans. And you can override this. So for example, if you're a FCAS country, but you think we do not need security costs, you can say no. But if you're not a FCAS country and you do want to include security costs, you can also override it and say we do want to include it. So it's really designed specifically for these conflict affected situations. And one of the key reasons is because the pilot countries that we had used the CVIC tool were countries which were in such situations. So this is really a core feature really of the CVIC tool.
Okay, so the next question is about CRO country. Do all CRO countries have their data upload so that they can use CVIC tool? Yes. What if a country is not using traditional immunization system in terms of traditional vaccinators as well as sites? Is this tool can be used then?
I'll try and answer that question. Oh, Raymond, would you like to go ahead first?
Please go ahead.
I'll attempt and you can help to correct me. So CRO countries, yes, I think essentially all member states are there. I think the complicated one is if you ask for the West Bank and countries like that, but I think we also have adapted it so we can cater for that. So it's like CRO countries for sure. I can't remember if North Korea is there, but let me know if you have that need. Then the question is non-traditional immunization systems in terms of traditional vaccinators as well as sites. So I think so. So this tool was not based on EPI, so it was built on a traditional system. It was custom made for COVID-19 vaccination in terms of the target population, in terms of the scale of vaccinations required. The vaccinators are a generic group of people in the tool, so they do not need to be doctors, nurses. They can actually be whatever cadre of health worker that you so specify. And there are up to 4 delivery sites, ranging from everything like going to the nearest hospital, to getting it vaccinated in a stadium, to a refugee camp somewhere, or to having to go to a prison, or to a remote area where they would need to spend several days overnight and pay for accommodation and per diems, etc.
Okay. So if no supplementation, then we move to the next question. Okay. So can the tool be used when budgeting the delivery of different vaccines at the same time? So I think the answer is yes, but Ryan can supplement more explanation.
Yes, it does. And you can select up to 4 vaccines concurrently, 1 for each different delivery modality. So you could, for example, say that we're going to vaccinate all the outreach people who require multiple days visits. We're just going to use a single dose vaccination. You can just specify that. And we'll keep our, let's say, ultra cold vaccines for the health facilities, which are very close by. And then we'll use our AstraZeneca for people who are going out on day campaigns, campaign sites, or going to prisons, or etc. So you can use up to 4 different vaccines. But there's one constraint, which is that you have to use 1 vaccine type per delivery modality. But we have thought of a way this can be overcome. And so if you have that particular need, so for example, you want to use a mixture of 2 different types of vaccines to reach people in remote areas, speak to us, we have a solution for that.
Yeah, I think Ryan already answered the second part of the next questions, which about the mix of vaccines. So we really encourage countries to reach out in case that you find difficult to use the tool to tailor for your country. And the first part of the questions is, are all vaccines included in the tool, like the Chinese vaccines?
Yeah. So we have a preloaded database of the specifications for WHO EUL vaccines, vaccines which have already got a EUL, where the specifications are known to us. And in addition to that, countries can create and customize whatever vaccine type they wish. So there's a whole list in one of the tabs where you can just put whatever vaccines you want and just tell us the specifications, and just you can just use that. So you can customize a vaccine if you like.
Sorry, and Wayan, can you also confirm that we do have the option of the tool each time you open it, it will be updated?
Yes.
Information. So
Yeah,
if we have new information, that is also one of the features of the tool itself. It will always being kept updated through the internet.
That's right. So when even after you have already filled in the tool, so don't worry about having to download. We're not asking you to download a new tool and then move your work into the new tool. Even the existing tool that you've worked with, you can go to you can enable external data connections, and then you can go to a menu called data and refresh all. And what the tool will do is, from your own computer, if you have internet access, it will download a fresh data set of not just different vaccine types, but also, for example, updated unit prices and for PPEs and for other supplies that if such changes do happen. So that is one of the features of the tool. It has an updatable vaccine database. So this vaccine database that we will have to update from time to time based on the new WHO EUL announcements and specifications as they come in.
Okay. So it seems that we don't have further questions. Any more questions? Yeah, because this is the last part of our session. So if no more questions, then we move ahead. But good, we have one more question here. Okay, by the time when the mass vaccination finishes, people shall be vaccinated individually. I would like how much can we estimate the dose of COVID-19 vaccines in sub-Saharan countries using FCFA? I'm not very clear about what FCFA is.
Yes, sorry, I maybe Domal, maybe perhaps you can maybe clarify your question. We have difficulties to interpret your question.
FCFA is the currency in West Africa?
Sure.
Maybe this question is about the integration of COVID-19 vaccination to the national immunization plan. That's my interpretation of this question. And I think he was asked earlier as well. Somebody asked a related question. It's like, once we just produce this estimate for COVID-19 vaccination, how do we move on towards thinking of it being part of the routine plan? That's my interpretation of this question. So I would say the tool does it somewhat, but it could be better. It's not really it was not really one of the key things that we were trying to figure out, as in this tool eventually will cost. Sorry, maybe I should just rewind. So the tool primarily costs out this mass vaccination campaign over a predicted time of about 1 to 3 years. But then I think by the time countries do wish to integrate this properly into a national immunization plan, and we get a lot more information about the durability of vaccines, its efficacy against variants, how often, what sort of a regime, and how it fits into the rest of the immunization schedule, then I think we will need to upgrade or change the costing estimates based on that.
Okay,
but
I think when also what the question could be is that whether the tool can adjust the currency to West African CFA. Do we have that in our list of?
We have a whole list of currencies.
Right.
Like all the currencies that I managed to extract from an global database. And so this tool is a bi-currency tool. So you're allowed to input any unit cost in both US dollars always and your selected local currency, and it will output the total in both US dollars and the selected local currency. Yeah, so it is, yeah, it's certainly a bi-currency tool. Yeah. And I'll also add that the exchange rate is one of the things which can be automated in its updates. So when you do this refresh, it will just pull the latest exchange rates as well.
Okay, we have another question. As local NGO and wants to participate in the service of vaccination of COVID-19 in Somalia, how do we partner and get funds to do the service? Okay, the question, how do we get funding to do the service of vaccination of COVID-19?
Yeah, so I'm not really particularly familiar with the situation in Somalia, but in countries there are coordinating mechanisms for the rollout of COVID-19 vaccines. I really encourage you to get in contact with these coordinating mechanisms through your government and to partner with them, and also then try to identify the funds needed to provide your services and help to the rollout of the vaccine.
Yeah, and the representative from the partners platform, Angela Shan, is also trying to answer the written comment. So you, so she may also direct you to the potential like donors. And, yeah. Okay. Okay. Any further questions from the floor?
May I just make just a general note? So I really appreciate all these questions. And I think one of the best ways to just start with this costing is just to try it. Just download the tool and reach out to us, and you'll realize that actually a lot of the questions that you may have will slowly be answered once you follow through the Excel and the Open WHO tool. And I just want to really emphasize that we do not really expect countries to be able to just do it on their own. Just look at the Excel sheet, even though there are detailed instructions, user guide, and Open WHO course, we're all available. And I think we find that it's really important for you all have to have real warm bodies to partner with you on the costing estimates, and we are all available for that. So feel free to reach out. And part of the reason is not because it's about using a tool. It's actually because COVID-19 vaccination itself, interpreting the NDVP and just really understanding the country context. This is not a walk in the park. So it's something that we would like to stand by and be available.
Yeah.
So don't feel like they are alone. Just download it and then you have to figure it out yourself. We are here. We have a structure of support available.
Yeah, and if I may add to what Rayon said, I encourage you, as he said, to use the tool. It can be intimidating once you open it, but you will realize soon, and that is not based on our experience, but really what we have learned from countries who have been using the tool. It is comprehensive, and and also in discussions, there are so many uncertainties, and you constantly need to update perhaps your costing plans because of new evidence coming available, or the strategy might change. The tool allows you to cope with all these uncertainties or certainties that have become certain, but also to update. And so, in addition to that, the easy version also has a lot of already preset, pre-filled information, which you easily can override. So it can be intimidating when you open it, but you will realize soon that it is really much in line with the NDVP or with your own plans, and it goes systematically through the different components of rolling out a vaccination plan, attaching all the cost activities and the estimates to that. Over.
Okay, thank you, Raymond. Okay, so if we don't have further questions, we can move forward. So we would like to have the feedback pool from you all. Maybe the ECHO team, if possible, we can now pull up the feedback pool. we really appreciate your participations during the sessions, and also we hope to have some questions answered by you for us to learn how much you get from this session, and we can also be better prepared for the next repeat session next week. And we have 4 questions to you, and you will very soon see the questions. Okay, the first one, after this webinar, I will use CVIC 2.2 or CVIC 2.2 easy. And you can answer yes, somewhat no. And number 2, after the webinar, I can start using the CVIC 2.2 or CVIC 2.2 easy to obtain the rapid initial cost estimate. Third, I will request technical support on COVID-19 vaccine costing. So basically this question I'm asking you will seek support from us, and so that we can also estimate our manpower to support you. We are really happy to support on the costing. And the 4th questions, after this webinar, I have a solution for the challenges that I have regarding COVID-19 vaccine costing, budgeting, or financing. Okay, so when we have more than half of you complete the pool, we will also put up the results. And then after this pool, we will have the final closing remarks, then we will close the session. Okay, and also really remember, so we have our contact email, so please just reach out if you have questions, and if you would like us to have a one-to-one orientation of the tool, because we know that today we are not really going into details of all the tool, each single cell, but we can do so in one-to-one session. So just reach out, and we know you need support, and we will arrange that. Okay, if the ECHO team is ready, we can also put up the full results. Okay, good to know that none of you said no for using CVIC, so 67% said will use, and 65% okay think that you can start using the tool to get a rapid estimate. That's good. And 56% will seek technical support, and 48% have their challenges solved, and also almost half, some of them solved and some somewhat. So okay, I think that's also good response from you all. We know that you can understand briefly on the CVIC tool, and you will start using it, and just reach out our email, and then we will arrange the support and see what you need, and we can arrange that. Thanks very much for your active participations in the pool. And ECHO team, please move to the next slide, or maybe the later one for the closing session. So it should be slide 61. And the slides and recording will be available online. So for this, we also prepare some answer questions so that you can also take reference. And here you can see providing you some links that you can access the webinar's information from the TechNet 21. If you have further questions, you can also ask the TechNet 21 forum or Telegram after the session. And thanks very much, TechNet team, for the support. And next slide, please. You will find the recordings of the sessions in French and English, and we will have the next repeat session next week with additional translation to Spanish. And after the summer break, on the last week of August, we will have the session on financing. Next slide, please. Thanks very much again for your participations, and thanks the translator doing the interpretations, ECHO team, presenters, and all the colleagues supporting the session. Any questions related to the session's topic that are not answered will be shared to the technical experts, and answered will be shared with the emails. Thanks very much, and have a good day, everyone.
And thank you, Corinne and Ryan, for facilitating.
Thank you.
Thank you.